Welcome, everyone, to today's episode of Carefulist, the podcast. I'm Katie Christophic, founder of The Carefulist. Today, we are talking with Kelly Baarley, who is the owner and founder of Kelly Baarley Bridging. Welcome to the show, Kelly.
Thank you for having me. I'm so excited to be here.
I am really glad that you can join us today because you and I had such a good conversation before, and I wanted to be able to share that with everybody who listens to the show. So, without further ado, how about you introduce yourself a little bit and tell us about your caregiving story?
Sure. So my name is Kelly Baarley. My company name is Kelly Baarley Bridging. And my first kind of introduction to caregiving or really even aging was the experience of taking care of my grandparents. And my grandparents, I always like to say they aged on opposite sides of the aging spectrum. My grandfather had diabetes and Parkinson's, and so as he aged and his diseases progressed, his body kind of failed him, but his mind was sharp as a tack till the day he died. Whereas my grandmother suffered from Alzheimer's. She was ambulatory though, and pretty well as far as physically for most of her life. But her memory loss and kind of the behaviors and different things that we see as Alzheimer's progresses really were present in the last few years of her life. And so all of that was a complete learning curve for my family. My dad's the youngest of four. None of them had experienced that yet. And I, being the one in my family with a healthcare background, kind of took the torch and jumped right in. But it became really, really clear to us that there aren't roadways really for families starting the caregiving journey. You can have the support of providers or sometimes home care agencies or things like that. But most often, families are left to figure out a lot of things on their own. And so, through that experience, that inspired me to start working in the senior care industry. And so, I since then have worked in hospice, home health, skilled nursing facilities, and have really just found a passion for working with the senior population. And so, Barley Bridging was inspired by helping families create the roadmap that makes most sense for them.
I am looking forward to diving into that a little bit. But first, you said you were the only person in the family who had experience. So, what was your experience before working with the senior population in healthcare?
It was various. I'm a military wife, and so truly the day after I graduated college, I boarded a plane and flew to San Diego to rejoin my husband. And the Navy kind of just moved us around a lot for the next 8 years. And so I always tell people it was both a blessing and an obstacle in my career. But the blessing portion of it is I was exposed to so many different types of healthcare. And I held so many different positions from healthcare leadership to being a medical assistant to being a certified medical technician that was able to administer drugs to being a surgical technician. So, really a diverse background in
Yeah.
healthcare. And after my experience with my grandparents, I really started focusing more on working with the senior population, and I found I really enjoyed that.
Wow. Well, and I think it's so important to emphasize that you have all of those background pieces because that really is what you used to continue the metaphor, to build the bridge
Yes. And I think a big
that,
part of that was, sorry, my public health background also, because that is so based in prevention, education, caring before crisis. And so I think a lot of what's inspired the work I do at Barley Bridging is also rooted in my public health background.
yeah, yeah. Well, there's so many things that we could talk about. Um, but I will try to keep my excitement focused. With what your family experienced, um, I think it's not uncommon for families to experience that, maybe at the same time, but certainly that array of diseases and symptoms and all of those types of things that one caregiving experience to the next is not the same.
Correct.
And so it's almost like when you've had kids, like one child, just because you had a kid doesn't mean you know how to parent the next one. And the same goes for caregiving. Like there, some of the basics are the same, but it's very different to take care of someone who has physical needs versus someone who has mental, needs and support. So the fact that you have a background in all of these different areas really sets you up to be an expert in helping people to navigate whatever caregiving situation they find themselves in. Um,
Absolutely.
yeah, go
Yeah.
ahead.
And I think another step that I wanted to take too before opening my business was my CSA license. That for me, on top of all of my other skills and experience, I thought was a really good way to demonstrate to people kind of my knowledge in the aging population and kind
Yeah,
of the different obstacles that families face or the different kind of things that may come up in your caregiving or aging journey. And so having to also earn that license and title, I think was also a big part of just taking the steps to make sure that I really was prepared for any journey. Because, like you said, everyone is so different and there are a million resources out there, but none of them are custom fit, right? They're all kind of the
yes.
standardized version of aging. And so helping families apply what they can, but also find what's specific to their needs is a really large part of what I do.
Yeah. Well, and in my personal experience, you hit the nail on the head. There's a lot of information, but
Mm.
parsing out what is good information versus what is helpful information versus what do I actually need? And is this the thing I need or is it not? And I'm now going to go down a rabbit hole that's going to waste time I don't have. Um, it is really, really helpful to be able to talk to somebody who knows what they're doing and can guide you through. Can't really call it a system because we don't have a system. It's the piecemeal information that's out there.
It's almost like a la carte aging. It's
Yes.
you but it would be like getting an a la carte menu in a different country. If you don't speak the language, you're trying to determine what you may want from that menu, but you don't know what it all
Right.
includes. And so you're just kind of
Yeah.
making the best guess you can. And there's so many different terms and subspecialties of
Right.
healthcare itself and aging and geriatrics. And so it becomes really colluded for families. And they're not supposed to know all those things, but they're also expected to be the guiding decision maker and leader in
Mhm.
care. And so it puts them in a tough spot.
Yeah, it really does. So when we're thinking about caregiving and the tough spots, when you were going through this as a family, um, obviously they pointed to you because you knew how to navigate things a bit. But as a person going through it, as the granddaughter going through it, excuse me, what was the thing that someone else did for you that was helpful? Was there anything? And if there wasn't, what would have been helpful?
Yeah, so two things come to mind when you ask that question. The first is the hospice team for my grandfather. They were truly a godsend and part of the reason that right after my both of my grandparents passed away, I jumped right into hospice care.
Yeah.
Especially since both of my grandparents died during COVID and they were both in care facilities. There were a lot of obstacles to just being able to see them, be with them, spend time with them.
Yeah.
And so being able to like wave through a window and seeing a hospice caregiver holding my grandpa's hand or getting a call from her after the visit, just saying, yes, he ate all his chocolate pudding today. Just knowing he was okay and that they were taking care of him in the same way that we would have been was really, really comforting for us. And the hospice nurse toward the end of my grandfather's life was a huge advocate for our family. She made sure that I was able to be there on the day he passed away, and I'm so grateful for that.
Right.
because we hadn't been allowed in his building in quite a few months when that day came.
Yeah.
And yeah, she just told the building, no, it's really important that he has family members here today. And so I'm to this day so grateful that I got to be with him when he went to heaven.
Yeah.
And I would say that one of the hardest things that was not helpful, and again, part of this was probably COVID, but on the day my grandfather passed away, my employer was like, well, do you have to go? Like, there's things happening here. And that was so difficult. One, because yes, of course, we had patients and we had needs and we had work to be done. But I had just told her his hospice nurse had called and he was dying and I needed to
Yeah.
go be with him. And so the lack of understanding or the lack of support in that moment was really tough. And so, as someone who since then has been a manager in a lot of instances, I make sure I'm always supporting my employees and making sure that they feel not only able to take that time, but supported in doing that.
Yes. I have talked to a lot of people who have had that experience. I personally had that experience. Um, well, mine was a little bit different. I was allowed to take the time and then I lost my job a couple weeks later.
Oh no.
But yeah, um, it's especially frustrating to me when someone works in the care field
Mhm.
that that level of understanding isn't there. And for me, it comes back to there are people who've lost someone that they love and people who haven't.
Mhm.
And I personally don't understand how you couldn't put yourself in someone else's shoes in that situation. Um, but I do think about those folks, and I know there is going to come a day where they're going to experience it
Mhm.
and they're going to think about how they handled it in the past for people that they work with and for, or who worked for them. And they're going to get it and they're going to be ashamed. And they should.
Mhm.
I'm not going to parse that. They should feel ashamed. So I'm sorry that that happened. But for folks who are listening, unfortunately, it's common. And all I can say is you will not regret missing whatever was going on at work.
Right.
You will regret missing your person
Yes.
and in their last moments. And you had it incredibly difficult because of COVID. And there are a lot of people who were in that same boat of not being able to be with their loved ones because of the pandemic. And that adds another layer to the grief. And for anyone who's listening, I would hope that if you went through that, you were able to get some support or some counseling through that, because being able to navigate the guilt that
Mhm.
comes with not being there the way you envisioned. Um, Most folks can't do that on their own, and um, that is not what's the word I'm looking for? I don't want to say failure, but I guess some people might think that it's a failure on their part, and it is not at all. Um, we can't control everything that happens, but we can do our best in every situation. And
Yeah. I'm just so grateful for that nurse to give me an opportunity to
yes,
hold his hand one more time.
yes, yeah. Oh, I'm grateful to her too. Wherever you are, ma'am. Your grandfather passed, and it was during the pandemic. Your grandmother's situation was not the same. That was a different situation, right?
So my grandmother actually passed exactly 2 weeks prior to my grandfather. So my family was kind of already reeling at this point. I believe it was December or January. We had decided to move my grandmother into a memory care facility. And
Mhm.
that was a really hard decision for all of us, especially my grandpa. We included him in that
Yeah.
conversation. And they were a very traditional husband and wife, high school sweethearts. I believe they had been together for like 67 years. They truly didn't experience life apart from one
Right.
another. And
Yeah.
so, one of the things that we did really work hard to try to do until the end of their lives was keep them together.
Yeah.
But her behaviors have progressed to a point where she wasn't safe in an
Yep.
independent living facility. Um, the extra caregiving that we had brought in was not in a memory care kind of skill set way. And so
Yep.
they were really overwhelmed and uncertain on how to best care for her. And she did have aggressive behaviors, which caused, concern for her hurting herself, the additional caregivers we had brought in, even hurting my grandpa.
Yeah.
And it was at that point that really was a turning point for the family because it wasn't safe for anyone anymore.
Mhm.
And as much as we wanted to keep them together, their safety had to come first.
Yes.
And so that was a really tough conversation to have, especially with my grandpa.
Yeah.
Um, but we let him know this is best for her and you and everybody that's caring for both of you. And
Mhm.
the people in the memory care facility are going to be able to meet her specific needs a lot better than what we're just trying to make do with.
Yeah.
And it was no fault of anyone's. Like I said, we truly
Right.
were trying to make do with the tools we had and what we were trying to do for her. It just wasn't the right environment for the level of care she needed.
Yes.
And so she lived there for, I want to say, only about 6 weeks or so. And then
Mhm.
we got the call that she had passed away one morning.
Yeah.
And so that was a different kind of grief too, because I feel like we started grieving my grandma much before she passed because of the Alzheimer's. We lost pieces of her along the way.
Mhm.
Uh, and so, in a lot of ways, I think that anticipatory grief kind of overcasted the grief of her passing. And it was
Yes.
also so unexpected because, like I said, even though um, the disease had progressed where she, was in very advanced Alzheimer's stages, she physically was very well and really didn't have any other secondary diseases occurring. And so it
Yep.
did kind of catch us off guard. Whereas my grandfather had been on hospice for 11 months already at that point and had been
Okay.
bedbound for
Yeah.
probably 6 of those months.
Wow. Yeah.
Um, but so, yeah, we were kind of reeling from that loss already. And then we got that call that morning from my grandpa's hospice nurse exactly 2 weeks later. And so,
Yeah.
of course, I did everything I could to get to him as quick as I could. And yeah, we always joke that my grandma was up in heaven going, "Let's go, Bob. I've been waiting long enough." And I
Yeah.
think for our family was a testament to the love that they had for each other, how closely to one another they passed.
Absolutely.
And I
Yeah.
think we always knew growing up that was the way it was going to be for the two of them.
Yeah. Yeah. It's a beautiful love story. And with that beautiful love story comes deep loss at the end and deep scars.
Mhm.
And they heal at different paces, and sometimes you think it's healed and then it opens back up a little bit. But I'm really grateful that you shared that, because that kind of love story, the story itself isn't common, but you hear that when people have been together for so long that sometimes they do pass quickly,
Mhm.
when one goes, the other follows. And that can be very overwhelming for the family.
Mhm. Yeah.
Yeah.
Those were the only two grandparents I grew up with. I never had the opportunity to meet my mom's parents. So my paternal grandparents, my dad's parents, those were my only grandma and grandpa in the world.
Yeah.
Um, it was a big loss that our whole family felt. But I think we were really comforted knowing they were finally together again. and they were together in a way that they hadn't been in a long time because of my grandma's Alzheimer's.
Yes.
That also brought us a lot of comfort.
Yeah. I feel that deeply because my mom had Alzheimer's. And so, it, it puts you in a weird spot when they pass because,
Yes.
like you said, you've been grieving them for so long. And then people who don't understand dementia are looking at you like, why aren't you wrecked? And you're like,
Hmm.
well, I'm wrecked on the inside, but I'm also relieved for them.
Yes.
I'm glad she's not stuck in this body with a mind that is holding her back. Um, so yeah, that could be a weird thing to try to explain to other people, but it's like gold when you find somebody who gets it.
Yeah.
You can talk
I
to
think
somebody who understands.
Yes. I think also as a caregiver, you get so used to kind of masking that grieving process or the
Yes.
emotional burden that comes with being a
Hmm.
caregiver or having a loved one you're slowly losing,
Yep.
because the world doesn't stop as your loved one ages
Right.
or declines or leaves the world. The world keeps spinning, and
Hmm.
family still needs you, and your job still needs you there, and your bills still have to be paid. All that keeps going. And
Yeah.
for people who have been caregiving for a long time leading up to the loss of a loved one, they've kind of already gotten into that cycle of,
Hmm.
for lack of a better term, putting on their game face each day. And even though their heart is aching and they're exhausted and they're
Yes.
sad, um, they've had to carry on for a long time already. And so I think a big part of that too is when you're grieving after such a long time, where grieving was already kind of part of your normal life,
Hmm.
um, you learn to kind of tuck it back into those corners that no one else sees.
Right. Yes. And it's not such a jarring experience when they pass because the grief has already begun. And that's a completely different experience from someone who passes quickly, who was healthy. It is not the same. So, we can't even say it's apples and oranges. It's not even in the same
Mm.
area of the supermarket. So, we've talked a little bit about what you're doing now after that experience of helping to shepherd your family through your grandparents' disease journeys, for lack of a better phrase. So, what are you doing now? And where can people find it? And I'll ask all the questions. Let's start there. What are you doing now?
Yeah, so it's funny. I officially opened my business just in the last year, but I joke with people that I've been doing what Barley Bridging does for a really long time
Yeah.
already. And that was because I just naturally had, family or friends call and say, "Oh, my mom just broke her hip. What do we do now?" Or our loved one just got this diagnosis. Where do we go from here? And so Barley Bridging was kind of inspired by my family and other families having those questions. And even after working in the senior care industry, learning that even with the support of a geriatric specialty doctor or a hospice team or private home caregiving, families are often left with a lot of those questions and not
Yeah.
sure where to start. And so I want to help families ask the questions they need to ask and give them unbiased support, answers, and education. I help them find the answers that they're looking for. I help educate them on what to expect or what next steps will be for them and their loved ones. I
Hmm.
help advocate for them a lot of times. And another big part of what I do is helping them plan and manage care needs from the very beginning. What I love to do is help families plan for what is inevitably going to occur.
Yes.
And I always tell people to start that process as soon as you can.
Hmm.
And so the way I do that kind of comes out in different ways. I have educational opportunities that people can participate in. I'm about to start doing a lot more virtual events, but I do a lot in my community. And then also people can do one-on-one consulting with me where
Hmm.
I'm there just in a supportive role, helping them, answering any questions they have. And then the other thing that I do is care management. So when families feel they need that extra level of support that goes outside the scope of just consultation, and they're saying, we actually want you involved in this process. The burden's feeling too heavy. Can you help carry the load?
Yeah.
That's where I'm happy to jump in and really help being that anchor for the family and the point of contact for all the care team and helping them make the decisions that they really need support on.
Yeah. Well, it's a wonderful service, and I'm grateful that you are using your experience and your knowledge to help people navigate that. And you said something really important, which, I try to hammer home with people. Um, and that is you can't plan early enough.
Mhm.
The time to have a plan is when nobody's sick, nobody's hurt. You have an idea, great, but have it in writing, better.
Yeah.
Share that plan with people, best. So yeah, I mean, there are different levels of preparation and things that you can do, but really talking with your loved ones, the people who you are hoping will step up and step in,
Mhm.
the people you are expecting, because one of the things you find out really quickly in caregiving situations is the team you have is not the team you think, um, for lots of different reasons.
Mhm.
People who you think will show up don't. And people who you would not have expected are there for you consistently.
Yes.
And um, it's a crapshoot. It's sort of like having a birth plan. Like, oh, look, I'm going to do all these things. And then the kid's like, no, not how that's going
Absolutely.
to work at all.
Yeah, and every family's different too on what level of support or consultation or kind of hand-holding they desire. And that's why I've also created my tools that I sell on my website is sometimes people don't need so much of that assistance, but they feel they need something to kind of supplement their family decision making and caregiving journey. And
Yeah.
so that's been the inspiration of all of the things that I've made on my store are their caregiving tools that help the caregiver or the family on that journey. And they can be things as simple as an in-home safety checklist or things as kind of thorough as my planning binder that has all those documents you talked about that it says this is where you put a copy of your advance directive, your living will, your post, your all of those things should exist and should exist here and have copies. And so I've created those tools to also be a way to aid families. And one of my favorite tools that I tell people, well, if you don't feel ready for the consultations or you're not really even sure if you're starting this journey or where to start it, one
Mhm.
of my favorite things is I have a conversation booklet that really starts the family
Oh,
conversation.
excellent.
And they're questions that families wouldn't know to ask because how could they, right? Before
Right.
they've
Yeah.
experienced any of this. But they're questions in my experience, I know families would have wished they asked sooner. And so
Mhm.
I put it all in a little booklet, and it can really be that conversation guide for families. And then from there, they can make a better informed decision of okay, do we need more support? Or now we know mom's wishes, so let's get the legal documents to support those. But it
Yeah.
really is a good initial stepping point.
Yeah. So now that you've told people about this booklet and everybody wants it, where can they go to get it?
Yeah, so my website, kellybarleybridging.org, has a store that has all of my items. They're both digital and physical. So a lot of my products are listed as digital just for ease of um, receiving. But if people want a physical copy, then they can also just send me a message through my contact me page, and I will create the physical copy for them and mail it to them. Also, all of my materials are available in Spanish because I'm bilingual. So that is also something that families can request through that contact me page.
Oh, that's amazing. Um, I'm so glad that you're doing this. So, for everyone who's listening, the interwebs reach everywhere. So, it doesn't matter where you are, you can get these documents. But for people who want to hire you for your consulting services, do they need to be local? I would imagine it's easier. No? Okay.
It's easier, but I've worked with people in LA and Milwaukee. I have a client right now based out of Madrid. So the
Wow.
beauty of technology is we can meet on a platform like this, or some families just prefer phone calls. There are a lot of ways that we can use technology to aid and support. And even though, obviously I know my local community and its resources best, I'm not
Mhm.
afraid of doing the research, and I'm very able in doing the research in other communities to help families. Um, Another program that I forgot to mention that is specific only to local is my Bridge Watch program. And so
Okay.
that's essentially a welfare program where it's the subscription basis, and families can ask me to just go check in on a loved one. And it's not invasive, it's not anything that's going to really interrupt their daily life, but it's
Mhm.
way, especially for long distance loved ones, to make sure
Yes.
their loved one is doing well. And so, what that looks like is families can subscribe for anywhere between 1 to 4 times a month,
Mhm.
and they pay at the beginning of the month for whatever their frequency is. And I just pick a day that I go and check on that loved one, and it really is just a knock at the door. How are you doing, Mr. So and so? Is everything
Mhm.
going well? I do a quick scan from the door just to make sure everything looks okay. I know
Mhm.
what to kind of look for, see if they're seeming a little different than how they were the last time I visited. And then I tell them to have a great day. I get back in my car and I send the family a live update on how their loved one is doing. And if families are really afraid that their loved one is kind of missing that human interaction, or this is more kind of them to have someone bringing them that human touch, then they can also ask for me to bring like flowers or their favorite treat or something like that. And so that program is specific to just my local community, but what I'm really excited about also.
Well, that's great. And where is your local community so folks
Treasure
know?
Valley, Idaho.
Okay. Oh, well, that's a really great service. Um, all of them, all of the services are fantastic. And thank you for using not just your educational background, but your personal experience to help other people. I know there are lots of different ways that we can process what we've lived, experience wise. Um, and for me, doing the Careful List has been very cathartic for my experience. And there's really a need personally, and I think this is true for a lot of the people I talk to pass along the kindness that they received. Um, and I think it speaks volumes to the type of person you are, to take what you've learned and what you've experienced and use it to help other people. Thank you so much for doing that. One of the questions I didn't get to ask you that I would still like to work in here, because of, going and visiting folks and doing those welfare checks and things, I would imagine there are moments, and maybe not that specifically, but within your work, um, where there's joy or humor. So if you have an example of one or both of those things, I would love to hear it.
Sure. So one of my favorite things that comes to mind is actually with my grandma. Um, she, towards the end of her life, was kind of regressing to where she was back in high school, and she was
Okay.
experiencing kind of life as 16-year-old her again. And so for a lot of families, that would be like a very sad or heartbreaking thing to see their loved one experiencing. And in some ways it was. But my
Mhm.
family also decided to be like, wow, this is an opportunity to meet 16-year-old grandma. And
Yeah.
so we would kind of joke around with her and ask her things like, so who are you dating now? Do you like Bob? That's my grandpa. And she'd be like, I don't like him very much. And we'd be like, oh, just you wait. And, and so you kind of have to find ways to turn those moments into joy. Something we were constantly saying in healthcare, we say often too, is if you aren't laughing, you're going to cry. And so
Yes.
laughing is a much better alternative. And so you just have to find the lighthearted part of all of those moments, and you can. Another thing that I think has stayed with me is the humor of just certain things that come with aging. For example, dentures. Um, I have a client who constantly forgets about his dentures, and I think he just prefers to not have them in. I think they're kind of a bother to him, but
Yeah.
his wife refuses to kiss him. And he doesn't have them in. And so it's just one of those little funny quirks of like an aging couple and the different things that come up in the aging process. But I just find it so funny. And she literally will like withhold a smooch until he goes and puts his dentures in. So it's just a really funny little thing.
That's really funny. If you can't pronounce the CH at the end of smooch, you don't get one.
Exactly.
Oh my gosh. Well, thank you so much for sharing that. That's fantastic.
Yeah.
Okay, so I will share um, the link in the show notes so people can go find Kelly's services. And just to reiterate, it doesn't matter where you live in the world, she is ready and willing to give you a hand. And as always, pairing before you need it is the best course of action. Cannot stress that enough. So if you need guidance of where to start, contact Kelly. You can visit our website at carefulist.com for resources. We are all here to help you. And as daunting as caregiving can be, it can also be some of the most connected and rewarding time that you spend with the people you love.
Yes.
So, with that, is there anything else you would like to share before we end the show?
I just always tell people you're not alone in this, even though it feels like you are a lot of times. Something that I always say is find your village, and it doesn't matter if your village is online, it doesn't matter if it's your family, it doesn't matter if it's your church or your community, but you will find people that can support you in some type of way. And it might not be the traditional physical way you expected to have support in this journey, but you absolutely can find people who will join your village. So just don't ever feel alone.
Yes, absolutely. There are people who are ready, willing, and able to support you in ways you haven't even considered yet. Um,
Exactly.
well, thank you so much for your time and sharing your story with us. And for everyone who is listening at home, we are here for you. Use the resources that are available. Talk to people who can help you navigate what's out there and figure out what's best for you. And as always, until next time, take care.